Health, wellness, and fitness. Who better than us? Today on the show, we're going to talk about what it means to really embrace that working with individuals beyond traditional physical therapy parameters of pain and range of motion is very much in our domain and specifically in all of our practice acts. And we're talking about the concept of not being scared so much of continuing to work with patients after traditionally maybe we would have discharged them and sent them on their way. So we'll start first with the topic of who better than us? Really, who better than us? An awesome paper was published a couple years ago now, the end of 2023 in JAMA, the Journal of the American Medical Association. Very great paper, huge study power. 4.3 million patient visits were studied, finding that the average American only spends 18 minutes per year, 18 minutes per year with a primary care physician. And then going on to find that primary care physicians very much so perform a concept called time discrimination, specifically with individuals who are younger, individuals who are of Hispanic descent, Black descent, and those with public insurance. So Medicare, TRICARE, and Medicaid. Why does that matter? Well, this study found that while most people spend a very small amount of time with their primary care physician, folks from those groups get even less time, and that the length of a primary care visit, the time spent with a primary care physician, has a positive association with inappropriate prescriptions, specifically of imaging, steroids, antibiotics, and opioid-based painkillers. And finding that the less time you spend with a primary care provider, the more likely in general, basically, your concerns are to be not heard and you're to be recommended kind of a generic treatment that may or may not actually help you solve your root issue. Versus when we look at the average physical therapy plan of care, it's 8.5 visits of an hour-long visit of 60 minutes. So that's 510 minutes or just about 2,800% more time spent with a physical therapist than a primary care provider. So literally, who better than us to work with patients on foundational principles of getting them moving with exercise, helping them understand basic concepts of nutrition and how to apply them to their life, and then the other stuff that we can work on with lifestyle with patients, helping them get a little bit better sleep, helping them manage their stress a little bit better. Now, how do we do this? Well, the first thing we do is we need to get over the fear we have of just, quote unquote, if you're listening on the podcast, I'm doing air quotes, just doing exercise. Are you just exercising your patients? You are only, quote unquote, only doing exercise with your patients. Yes, we are, right? I would argue the best dollar spent in the healthcare system is going to be with a physical therapist. When we look at what the costs are of common treatments and surgeries, what those outcomes are, compared to what do outcomes look like if you can spend 1 to 2 days a week with a really skilled physical therapist who can, yes, early on address your pain, your range of motion limitations, whatever, but then take that person through the realm of health, wellness, and fitness. And on that topic, it's really important to understand that every state has direct access to physical therapy, even if it's just for the initial evaluation. And every state has at least a little bit of language on what we're talking about, on the fact that a person does not need to be in pain, a person does not need an official physical therapy diagnosis to work with a physical therapist for things like wellness, health, and fitness. There are several states that contain really explicit language, and some are very strong on what we can do. Your state practice act contains language that physical therapists are supposed to be working with people who are asymptomatic to reduce the risk of their potential injury, even if they've never had an injury in their life. Physical therapists are supposed to be promoting and maintaining, keyword maintaining, a person's fitness, health, and quality of life. That word maintaining, I think, is very, very important because it's my belief that if a person stops exercising on a regular basis, of course they're going to regress their strength and conditioning, which means every single person should be basically always doing it. Otherwise, obviously, people are going to take a break for vacation or having a baby or something like that. But along the span of their life, they should always be working on it, if only to maintain what they currently have. Your State Practice Act also has language that we are supposed to be helping patients age well. I love that term. How do we age well? Probably looks like a lot of strength and conditioning. Physical therapists are supposed to be providing services that improve the conditioning of a patient, the reduction in stress of a patient, and the overall promotion of fitness of a patient. And then physical therapists are supposed to be developing fitness and wellness programs for asymptomatic persons. It is in our legal power to be doing this stuff. I specifically love Connecticut's State Practice Act. It's very strong. I'll read it word for word. Quote, nothing shall prevent a physical therapist from providing wellness care within their scope of practice to asymptomatic persons without a need for a referral, end quote. I mean, that's a nail in a coffin, right? It doesn't get more clear than that. Nothing shall prevent us from doing this. We are allowed to see people without a referral who are asymptomatic and work on their general health and fitness, period. And we need to be doing a lot more of that. Before we talk about how to start doing that, I'll take a little break and introduce myself. My name is Alan. It is Fitness Athlete Friday. I have the pleasure of teaching here in our Fitness Athlete division. Some courses coming your way from the Fitness Athlete division. Your next chance at Fitness Athlete Level 1. That's our entry-level online 8-week guided course that will start March 24th. And then a couple of chances to catch our live seminar where you're going to move a barbell. You're going to get a lot better at coaching, cueing, correcting, corrective exercises, all that sort of stuff. You have a chance this weekend, as in tomorrow, March 1st and 2nd, out in Solana Beach, California. That'll be with Zach Long. You have another chance in March 22nd and 23rd, down in Claremore, Oklahoma. That'll be with Mitch Babcock. And then the first week of April, April 5th and 6th, you can catch Joe Hanesco out in Windsor, Colorado. So how do we start to do this? We embrace what we just talked about, that we have it in our Practice Act. We are legally allowed to do this. We're actually being told in some language in our Practice Act that we should be doing this. And that if we're not, we're kind of messing up. We're not practicing within the full scope of our ability as a licensed physical therapist. So we need to stop being scared of this invisible boogeyman that does not exist. This belief that if someone comes to our clinic and they lift a weight or they get their heart rate up and they're not in pain and they don't have any range of motion restrictions, that a helicopter is just going to appear out of nowhere and guys in black uniforms are going to crash through the roof and take us to jail. That's not going to happen. There is so much evidence about the benefits of strength and conditioning. It is really hard to deny that we're not providing a positive benefit in a cost-efficient manner to our patients. And we really need to start to embrace that probably what most of our caseloads should look like as we start a position. It's going to be a lot of evaluations and new patient care, but over the course of maybe years, our caseload might just start to look like a bunch of patients we've already previously worked with that are just doing maintenance care, that are coming in once a week, twice a week, every other week, whatever. And that's awesome. Why? Because we are providing a lifelong service to those current patients, but that's also really awesome for business growth. Because at a certain point, you're not going to be able to take many more or any new evaluations, which means the clinic needs to hire a new therapist, which means the clinic is growing, and that's always a good thing. So we need to be confident that we have the legal ability to do this stuff. We need to be confident in the benefits of strength and conditioning. If you're not convinced of that yet, please take one of our courses. We will hammer you with the research about all the different things that strength and conditioning can do for a person, no matter what their age or population, no matter their condition status. We know that when we look at the research too, this is maybe something we don't want to admit, that strength and conditioning always, 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 always beats traditional physical therapy in both the improvement of strength parameters, conditioning outcomes, but also almost always when we look at studies that compare traditional strength and conditioning to traditional physical therapy treatment, we see that the folks who do strength and conditioning often report lower levels of kinesiophobia, fear avoidance beliefs, and they almost always report improvements in patient satisfaction and adherence. So we know it's a more fun way to get results in a way that translates to function in real life a lot better. Almost every single human being knows they need to be moving. Most of them just need help getting started. They need a safe space. They need to learn what to do, how to move. They have 1,000 questions they need to ask. And that's where we step in and really embrace our role is not just a person that reduces pain and improves range of motion, but gets a person fitter, right? Like our CEO, Jeff Moore, would say, how fit will you let us get you? And part of that comes in embracing the legal protection we have, but also the practical implications of how potent a treatment just again, air quotes, strength and conditioning and general exercise can be. Inside every single human being is a little monkey that wants to lift heavy shit with their friends. We just need to help those people unlock it. And then not only will we have a patient for life, we will have made a really profound impact on that person's life. So I hope today you go in the clinic with a little bit less apprehension that someone is quote unquote just doing exercise in your clinic, and you think, wow, how cool it is that this is what we're doing, that we've got this person to the point where we are now promoting their health, promoting their fitness, improving their strength and conditioning, reducing the likelihood of future injury risk. We're doing a lot for that person. Hope you have an awesome Friday. Have fun with 25.1. I'm headed to the gym in an hour or so to do it. I hope you have an awesome weekend. If you're going to be at a live course, have a great time. We'll see you next week. Bye, everybody.